Everyone, I'm back and I'm here to speak to a very special guest. We're going to talk about fertility today. Now, those of you who are listening, you know me as Dr. Manny, the IC healer, and for the last 6, 7 years, I've been working with patients to help heal their bladder pain. What was interesting as I was working through this journey is people were coming to me for bladder pain, but many of them also wanted to get pregnant, but they weren't actively trying, and people were getting pregnant while under my care. And I thought, wow, this is really interesting. What am I doing? And I realized that I was improving their health with the nutrition that we were working on. So I went on my own fertility journey. I conceived my last child last year at age 46, and it was my third son, my third baby, actually. I have two other kids, and with my new husband. And I thought, I had to do a lot of the same things with everybody to improve my health so I could conceive. We did use IVF, and I conceived on the first IVF transfer, which was great. So I thought, this could be an interesting new niche for me. And so this is what I'm doing. And I'm really excited to be able to help people improve their health and improve their outcomes. So I'm here with Dr. Amy. You may know her as the Egg Whisperer. And we're going to talk about a bunch of really interesting topics. And some of them are going to be new topics that you may have not heard about in the fertility world. So I'm excited to talk about that. Hi, Dr. Amy.
Hi, thank you for having me, Mandy. It's such a pleasure being here.
It's a pleasure to have you. We're super excited. So, really important question. Number one, tell us about your history, the Egg Whisperer. How did this start? What inspired you to get into fertility?
Yeah, I mean, the inspiration came from my family. So I was born with a gene, and that gene is helping everyone get pregnant who wants to have a baby. It's insane. So my grandfather was an OB/GYN, my father was an OB/GYN, and out came me, and I came out of my mother's womb saying, "Who wants to have a baby?" So it's just like something I always wanted from the age of 3. I knew I wanted to be an OB/GYN, and then when I was 12, I knew I wanted to be a fertility doctor. And so that was just my life's passion and goal. So after medical school, I did OB/GYN residency and then training in infertility. And then I started my practice in 2008. And so much has changed in the last 15 plus years. It's been really fun to be a part of. And, one of the things that I do is I give people hope sometimes when all hope is lost. And Egg Whisper, that name came from a patient of mine who didn't know what she wanted to give me a gift after I helped her have her twins. And the gift she gave me was a website, eggwhisper.com. And that's where it all came from. So she's the one that came up with it. And it just kind of has stuck. And over the years, my approach has become more holistic. I'm going to do something really quick with you, Manny. I just came up with this yesterday. So you're going to laugh. But so I just came up with this idea, like, how can I express to people like all the things that they need to do to get like ready for pregnancy? And maybe you're gonna use this. So number one, make sure you're mentally ready. Number two, make sure you get good sleep. Number three, make sure that you're emotionally well and your heart and your relationships are sound. Make sure your uterus is healthy, your ovaries are healthy, and then touch your legs and you're moving your legs and you're getting enough exercise. I should probably point to the stomach and say you're getting good nutrition for you. So, I mean, like I'm always trying to think of ways to kind of explain things to patients. That's kind of my jam in a way that they can understand. It's not overwhelming. I'm not coming from a scary place, but it also makes people feel happy and hope filled.
I completely agree with you. And as you know, even though my scope of practice is in clinical nutrition, I have to get into all of those different areas too with my patients as well, because they're all connected. That's a really good point. I think the emotional piece of it is overlooked too. I think people do not understand how important that is. I think this is probably why a lot of people conceive when they're on vacation, when they're not trying anymore. Do you agree?
I mean, I wish my patients would conceive on vacation, but yeah, I mean, it's true. Sometimes when you're feeling really good, what happens? You let your guard down and you have sex. And I tell people when two people love each other, miracles can happen. And a lot of people forget to have sex. And sometimes sex happens when you're on vacation more than when you're at home.
Yeah, that's true. And I love how you said that knew at age 12, because a lot of people don't know what they want to do when they're 12.
Yes.
Yeah,
Yeah,
that's
totally.
awesome. So, okay, so
Yeah.
let's talk about age because this is important. I think a lot of people who have come to me recently for fertility have been older. So, this is going to be a difficult conversation, I think, for a lot of people to hear, but I want to hear your
Mhm.
take on it. Age is just a
Yeah.
number in fertility, and we know it impacts egg quality. Now, the newest research also says men also are affected by age because of DNA. Can you talk
Mhm.
about this? And what role does mitochondria play specifically, and what other factors are playing a role in?
Yeah. Yeah, I mean, age is like, if someone were to say, I'm 50 and I'm so old, I would say, well, age is just a number, except when it comes to your ovaries. When it comes to your ovaries, it's one of the most reliable predictors of pregnancy, especially for a woman over 40. And we know that mitochondria, as we get older, they are not as strong. They are the battery center of the cell. And so if your mitochondria doesn't have enough energy to turn an egg cell into a healthy embryo, you're mostly going to have embryos that are not genetically viable. So, there are a number of ways where we can build and boost NAD in our cells, which is what's required to give our mitochondria enough energy. And that comes from nutrition, good sleep, exercise, taking supplements like OVA NAD. And, unfortunately, no matter how much work you do and you put into your mitochondrial health, it just might be too late. And that's just unfortunate. And I wish and I hope and I pray for the day where there are therapies and treatments that I can do that will guarantee. One of those things would be something like mitochondrial replacement therapy in the future. But for now, all I can do is support patients with lifestyle changes and sometimes things like rapamycin therapy and ovarian PRP and some supplements that you can take orally or inject like HGH that could potentially help. And I always want patients to know what's available for them at that point in time. So right now these are the things that are medically available. And that way they feel like they can empower themselves with knowledge and then figure out what they feel is right for them, whether they want to choose those things or not.
Okay, so let's talk about mitochondrial replacement therapy then, because this is
Mhm.
something people are bringing up to me a lot when I have
Yeah.
conversations with them. For the newbies, what is it? And why they say it's controversial?
Mhm.
Um, do you think that who do you think could be a good candidate for it? And if you know the statistics on how successful it is right now, because I don't think they're doing it in the US. I think they do it overseas.
Yeah, I mean, it's controversial because you're basically transferring DNA from one person to another. So it's illegal in the United States. It's actually quite easy to do. And I wish that it was something that every woman had access to, especially women who are over the age of 40. Maybe even younger women who have low AMH levels or have low egg quality would also benefit. But MRT could solve the issue of why older eggs don't work properly. So there are a number of different ways of doing it. Basically, you're taking the mitochondria from someone who's young, from their egg, and you're injecting it into an egg that doesn't have as healthy mitochondria. You can also do a nuclear swap where you take a nucleus out of a donor egg and take the nucleus of an older egg and place it in. So there are a number of different techniques, technologies. Every clinic will do it their own special way. There are clinics in Albania and in Cyprus, and there's now a clinic in the Bahamas. That's Dr. Murphy's clinic that's offering it to patients. I've been freezing eggs probably for the last 10 years with the hope that my patients will be able to have access to MRT. These are patients who are over the age of 40 generally who will never use a donor egg because they want to have a baby only if it means using their own DNA. And I think that's a very personal thing, and that's for them to decide and not me. So I think MRT offers women this option of being able to do that. And I think the statistics, we don't have enough data to tell patients like this is what you can expect from this treatment. We have animal studies and we know it works pretty well, let's say in mouse eggs if we do it that way, but we don't have enough information about female human eggs yet.
Okay, and so that solves the problem with mitochondria. So now what if does the nucleus also have gene mutations or DNA damage? And would that be a problem in that treatment? Just curious.
I mean, for the most part, you could still have chromosomal abnormalities in the chromosomes, even when you're replacing the mitochondria, and you can still have genetic disorders related to different genes. That's why this treatment is not 100% accurate. So, um, most patients who are going through MRT, at least for me, in the program that they're going to be going through, we will still be doing PGTA and we'll still be screening their embryos for chromosomal abnormalities, even though we're using younger mitochondria to make their eggs healthier.
Okay, so you actually can work with other clinics to get them to do MRT within your patient population. They can go overseas and get it done.
Oh, yeah, absolutely. I encourage patients who, part of my discussion with patients is asking them what their goals and priorities are, what they want. And then we talk about what is it going to take. And then we talk about whether they're willing to do it. And so for some patients, traveling overseas is something they're absolutely willing to do. So I support them in their journey. I will freeze their eggs. I will freeze sperm. We will ship them to the clinic of choice. I also have patients who I support here locally, and then I support them with their IVF cycles here up until egg retrieval, and then they travel overseas for their egg retrieval.
Got it. Okay, cool. Alrighty, next question. So when you're looking at IVF cycles, how often do you suspect that it is mitochondrial dysfunction or genetic mutations as the root cause versus, and the other would be the sperm. So what, in your opinion, what percentage do you think is actually the egg and what percentage might be the sperm overall?
I mean, I think most issues related to chromosomal abnormalities in embryos is egg driven, but not all. And I think most of the answers as to why things don't work is in our DNA, egg and sperm. And it can be a combination of both of them. And, as a man gets older, there are more issues with embryos created with older sperm, including chromosomal issues. Studies show that when men over the age of 50 have a higher chance of causing an embryo to be chromosomally abnormal than a younger man. And so, women so often give up their own DNA for a man. And when I have a patient who's, let's say, 43 years old and she has a partner who's over 50, I will say, look, like very soon you are going to have to use an egg donor. But your husband's sperm is causing your eggs potentially, if you have even one healthy egg in there, to be less viable when it becomes an embryo. Would you like to try a sperm donor and see if we can accomplish our goals with a sperm donor rather than using your husband's sperm? And I have patients who are like, wow, Amy, I've done 6 IVF cycles. You're the first one that's told me that. I really don't want to use an egg donor, but everyone tells me I have to. And I say, no, I think you should actually use a sperm donor instead. And I've had patients who've done it and have their first euploid embryos after they've
Wow,
done that.
that's the first
So
time
I
I've heard
think
that.
it's important to kind of talk through everything that a couple's willing to go through, be really honest and upfront and realistic with them about what they need to be thinking about. So, for example, anyone's over the age of 40, I talk about an increased risk of having a child with autism. I think it's important to know, especially if the husband is or the male partner is over the age of 50. And then if you have a female patient that's over 40 and a male patient that's over 50, they should know that they're both contributing to an increased risk of that and they should be okay with it. They shouldn't find out after they have a child with autism that in fact their age is the reason why. So I feel like people need to be informed and then they need to take the risk and be at least hear about the risk and then say to themselves, I'm willing to take that risk before they move forward.
Yeah, that puts a lot of things on the table because then you can show them, the different options, egg, sperm donor,
Mhm,
they're using their own egg and sperm and then what the risks are. So that's really interesting.
mhm.
That was a very interesting comment you made about male factor infertility.
Yeah.
To the next question, because you said that sometimes it is the guy, and especially if the woman is under 45. So
Mhm.
speaking of the men, what are the most common male related issues that you see?
Yeah. I mean, I think, first of all, you know, there are not that many really great tests for guys. And so we have the semen analysis. And then what people don't realize, there are still other tests that you can do, but they're not the best. So we have the sperm DNA fragmentation test, we have a sperm DNA methylation test. But the things that can cause male factor are things like anatomic issues, like a varicocele, which is a dilated vein that sits on the testicle, sperm DNA fragmentation issues, sometimes due to low testosterone. Guys sometimes don't take good care of themselves, so they're overweight, they're diabetic, they're hypertensive. And when you're overweight, you carry more heat around your testicles. And so that transmission of heat can worsen sperm quality. Along the lines of heat, we have a whole, trend here, at least in California, where everyone's doing cold plunges and everyone's doing saunas. So those two things can also damage sperm. So temperature fluctuations that are extreme, And, alcohol consumption, so environmental toxins can also harm sperm, exposure to pollution, nicotine, marijuana. And then lastly, I think I already mentioned low testosterone can also impact sperm quality and obviously impact someone's sex life.
Speaking of testosterone, is it true, and I know this is kind of off topic, but is it true that testosterone therapy can cause low sperm count if they were taking exogenous testosterone?
Yeah, TRT, testosterone replacement therapy, is the fastest way to sterilize a man. So I have unfortunately seen cases where men are taking TRT and they haven't told their wives, and they've been trying for a year, and the wife finds out after the fact that he was doing it and didn't tell her. So, long story short, guys, don't do that. But TRT is basically birth control for men. And it can take, sometimes it doesn't really come back, but most of the time it does, but it can take even like a year for the sperm to come back once you stop it.
That was us. That was us.
Yeah.
He was taking TRT, but he wasn't taking it regularly. So
Yeah.
luckily he salvaged some sperm and we did a year off and we did a whole bunch of antioxidants and stuff and he was night and day difference with his sperm.
Wow. Good.
Yeah,
Yeah. I mean, you
yeah.
can boost it with Clomid, HCG, Arimidex. There's so many things a guy can do other than TRT to increase their testosterone.
Okay, so lifestyle and supplements. What have you found to be very effective for boosting mitochondrial health for men
Mhm.
and women who are trying to conceive?
Yeah, I mean, along the lanes of the head to toe. So, like exercising, sleeping well, hydrating, avoiding alcohol, avoiding nicotine, NAD boosters. Like, those are the things that I tell patients to do.
Okay. And so in the future, what advances in reproductive technology are you excited about? I know you talked about MRT, but is there anything else in the pipeline that you know about and how this could redefine treatment options for patients who have?
Yeah, I mean, number one, I would love for menopause to be reversible, not inevitable. So, is it possible that that could happen in my lifetime? Possibly. If you think about ovarian tissue transplantation, and the possibility that a woman could, let's say, get an ovary removed when she's 40, and then every 10 years she has a graft where a piece of that ovary is then put back in her body so she continues to have menstrual cycles, and or you don't even need to have periods but continue to have exposure to her own estrogen. Well, that might increase her lifespan and it might prevent menopause. Like, that to me would be pretty exciting. So, is that possibly going to happen? Maybe. I don't know. The other thing is something called IVG, which stands for in vitro gametogenesis. So that's where you can, and I have lots of patients who are trying to volunteer. And I'm like, we all have skin. We're good. I don't think we need volunteers, but where you can take a skin cell and convert it into a sperm or egg cell. That's really exciting. Because what does that mean? No more egg donors. Number two, no more fertility injections. No risk from OHSS, no risk from surgery. Like, how cool would it be that you're like, I'm ready for a baby. I need IVF. I'm just going to go in for my biopsy and they're going to culture my skin cell and convert it to an egg cell. That's pretty cool. Are we 5 years away? I think so. Clinically speaking, are we 10 to 15 years away? Probably. So, probably in a generation from now, that's something I predict we will see, but just not in the immediate future.
Maybe not our lifetime.
I mean, I want to be here in 10 to 15 years. So I feel like we will see that in our lifetime.
That's so interesting because the skin is a somatic cell and goes through mitosis, but then you have meiosis for the
Yeah,
gamete.
I am not a stem cell expert at all, but there's if you there's a big publication that everyone was talking about 2 weeks ago related to IVG and some of the breakthroughs that they've made recently.
Wow.
Yeah.
Very interesting. Wow. Well, this was a great conversation. So I was going to ask you something else. What was it? So where are you located, you said again?
San Francisco. So that's what I tell people. I'm right outside San Francisco, but I'm in the San Francisco Bay Area, California.
Very nice. And how can people reach you?
Really easy. Anywhere where you can just put Egg Whisperer in a search engine, you'll find me, maybe except not OnlyFans, but maybe one day soon.
Great, great. Well, it's great, a pleasure. I'm going to
Thank
talk to you
you.
offline real quick. It
Yeah.
was a pleasure meeting you, and I'm looking forward to more from you.
Thank you, Mandy. It was so nice to meet
You
you.
too. Thanks.